Police are telling us today they've been in touch. Police telling us today they've been, okay. Police have been in touch with several groups that are planning on coming on Saturday. Some of those groups have made it very clear that they plan to be armed, but police telling us today they still don't expect it to become a violent weekend. But police telling us today they don't expect any violence. Let's take a look at the park right now. Less than 100 people. Okay. Let's take a look at the park right now. Quiet with a small crowd. We do anticipate that to change this weekend, along with some traffic patterns. Police telling us today. Okay, we'll be fine. Also, I don't think we're at the top. I think we're second. Rep Arena is at the top. Well, I have a feeling CTES is still sleeping because he has his red receipts on and he hasn't read it. So I'll just go down there and try and find a happy soul. Sometimes people are fine, sometimes they're agitated. But the people under the water tent are usually pretty good, so I mean, we're gonna say, yeah, we welcome them. They're not gonna be like, they're gonna disrupt our...
You're not in boxes or anything, are you?
I don't think so. Have you seen, like, I haven't done 4 o'clocks in a while. Have you seen it where, like, they have you scheduled for a 4 and then they just take Beshear and the 4 gets canceled?
Yeah.
So that's probably what'll happen.
Probably what's going to happen, especially since you're not at the top.
You're right.
Because usually, it seems like he's always within 2 or 3 minutes of the top of the
Yeah.
So
Okay. And we usually start the 4 2 minutes beforehand.
That's the 6.
I think they all start
Do
2
they
minutes
all?
before, yeah.
So, yeah.
So there's a chance. Cause,
yeah,
okay.
It's 50-50, I guess.
Is that what you would say? Yeah, I'm ready. I'm so ready.
So ready.
But if he starts on time, it'll probably be as Jesse's live shot comes to an end. Okay. Yeah. As I'm like mouthing things to you.
I mean, they can just, that's a pretty easy MLS kind of thing. Everybody in Lexington's going to have an opinion on that.
Yeah, 100%. And they're all going to say, don't do it.
Oh, yeah.
Yeah, the 7 people that are protesting against it. Peake's sister's dog is named after Adolph Rupp because they called him the Baron, so his name is Baron. And they're not racist at all. They're wonderful people. Truly. To whatever Rupp is, the new Rupp Arena is.
Yeah. What's that going to be? Drake Arena?
Drake Arena.
Isn't it? Yeah, Drake.
Who's Drake?
Isn't he the dude? Who's the big, like hip hop R&B dude?
Oh, Drake. Oh yeah, he's a
Drake,
big
yeah.
Kentucky fan. You're right.
Change it to Drake Arena.
Or they'll name it Tubby Smith Arena.
There you go.
Tubby.
Tubby Town.
Tubby Taverns. Tubby Town.
Yeah.
Was Tubby Smith, was he basketball or football? He was basketball? Wasn't there another person with like a silly name that coached football? Maybe not.
Yeah.
I need peek.
There was some funny name. I can't think of it. Billy Gillespie was another basketball coach.
Yep.
But there was one of the football coaches.
It was like a Bubba or something weird like that. Like a Tubby name.
Yeah, some kind of Bubba.
Never in my life would I think I would know Tubby Smith's name, though, I'll tell you that. All right. I don't hear anything, so.
Those clouds help.
Definitely. Well, police telling us today they've been in touch with several groups that plan on being here Saturday, and some of those groups have made it clear that they will be armed. Still, police say they don't expect any violence to come this weekend. Let's take a look at Jefferson Square Park right now. See, it's pretty quiet with a small crowd here. We anticipate that to change on Saturday. Something like that. I can hear you. A minute out from the open. Oh, you're right. So it only starts like a minute before. Does it look better if I walk out of the way or if I turn around and you pan?
Turn around and then walk out of the way.
Let's take a look at Jefferson Square Park right now and then do that. Okay. And you're good with me walking out of the way that way?
Yep.
15 seconds. So no live shot. So we'll be next. That was
reporting 7 deaths today. And the spread in ages today ought to tell us something too. There's 1 in their 40s, 1 in their 50s, and 3 in their 60s. As we see the number of people passing away with COVID being a factor, number of people in their 60s increasing, I think, pretty significantly. Today, we've lost a 49-year-old woman from Fayette County, a 57-year-old woman from Jefferson County, a 64-year-old woman from Knox County, an 88-year-old female from Ohio County, a 68-year-old woman from Whitley County, a 60-year-old woman from Casey County, and an 89-year-old woman from Ohio County. So remember to ring those bells. We do it in this rotunda every day. We have a long-term employee from the Secretary of State's office that comes out and rings that bell 120 times, one for each county, every single day. Let's make sure we turn on those green lights. Family members need those during these times. We also will have our ethnic and racial data up online. It is generally unchanged from yesterday. Age distribution, next week I want to look at some of the trends of what we're seeing. Certainly a larger portion is shifted to those under 40, but there's still, when you look at who can get it, it's in all age groups. And as we're testing more of certain age groups, we're finding more positives. So the way we need to look at it is everybody can get this virus. No one is immune. No one is that we know is less likely to get it by age. So let's make sure we're all protecting ourselves and each other. Long-term care facilities. A little bit of tough news here today. 20 new residents have tested positive, 6 new staff, and we've got 1 new death of a staff member. I don't have the details on that, but again, it's always a tough loss. 4 new facilities have at least 1 case of COVID-19 related to it. Kentucky child care facilities, same number of facilities that are dealing with at least 1 case, thank goodness. 1 new staff, but 4 new children related to those centers. So we continue to see our numbers higher and really much higher than they were 2.5 weeks ago. But it's about time to start seeing some of the efforts that we have made. We're going to be looking very closely at the data through the weekend, and then next week we're going to have to really start seeing at least a leveling off. That's what we would expect to see first, or we'll have to consider additional steps at that time. We just can't let this thing get out of control, and I can tell you from this administration's standpoint, we won't. We'll continue to take whatever actions that we have to based on the guidance of the White House and our public health officials to make sure that we can stop the escalation. Now, we need good news, and there is always good news. The good news that had me hopeful yesterday and hopeful today is we do see more people, and I think we feel it around us, that have realized it's time to come back, get excited about Team Kentucky, and do the right things. That we are in just as critical of a moment as we were in late March, and there are some different things that we can do now that means we don't have to go through what we did in March. So I want to look at a little bit of the positives we see out there. Again, this is a return of chalk art, which is just one effort at a time when we've asked people to do less. And we're certainly asking everybody to do less. Fewer contacts than you were doing before the 4th of July, fewer people over to your house, fewer house parties. Those extra things you do, cut down on them a little bit. I know that my family certainly has at this time, and it's both because it's the right thing to do and out of concern and where the virus is right now and our children's potential exposure to it. Next one is from WKU. It's taken pride in being a hilltopper, also taken pride in wearing that facial covering to ensure that we are protecting other people. And again, wearing a facial covering helps us do 3 things. Number 1, protect lives and health of Kentuckians. Number 2, protect our economy. It's not just me, it's the economists that say the single greatest threat to our economy is not getting on top of COVID-19. Wearing a facial covering is one of the best ways we can do that. And number 3, trying to get our schools reopened in a safe manner. They're helping with all of those. All right, let's go to the next one. I thought this was really interesting. This is a behind-the-scenes look at a library and how they handle the items during quarantine. To ensure that the items are safe for checkout, they have to hold these for 4 days. So, I have taken my kids to the library a lot as they've grown up, and, you put the books back in the book slot, and normally I'm sure they're back on the shelves pretty soon. And look at the extra mile that our libraries are going to make sure they're safe. This would have been something that we probably would have never thought of, but this is the ingenuity, this is understanding enough about the virus, and this is doing the right thing to make sure that our kids are safe and continue to be able to spread the knowledge out there. So, what a great example that's being set there. All right. This is our media. And again, if we could turn the camera around here, you would see every single person in this rotunda wearing a facial covering. And we've asked our media, because they're known in the community, to make sure that they are showing the public and the world that they're living up to their responsibility, like we all have, to wear a facial covering. We appreciate that. And, this piece has got to be a partnership between everybody. And the media has been a good partner in getting the word out on facial coverings. And last, I just thought that this was heartfelt. Denise is feeling what we are all feeling. The difficulty of the time that we've been dealing with this, of the loss, of the cases going up again, the anxiety of what's going on to our south and our southwest, and she felt the compassion. Just having those green lights out made an individual Kentuckian out there feel the way that we want people to feel. It's the reason that we do these. All right, next we're going to have Secretary Freelander come up. He's going to give an update on our program on testing staff at long-term care facilities so we can continue to work to prevent the spread.
Thank you, Governor. Today I want to talk a little about long-term care facilities. First, I want to thank the federal government for their partnership. They announced just the other day that there will be additional $5 billion going to nursing facilities and veterans facilities across the country to help with PPE, to help with testing for these facilities to be able to do that. They've also announced that over the will be lower on the list than most. So in the interim, before those machines can get out, we are, along with working with our long-term care task force, we've talked about that before. We have many folks who are helping us, including a medical ethicist, who is really keeping us focused on the most important thing that we are doing right now from an historical and academic perspective, is saving lives. That task force has provided some guidelines for us. Today, I signed a contract that will allow laboratories to bill us directly for maintenance testing of staff and residents at all nursing facilities across Kentucky. What we are asking and guiding the nursing facilities to do is to have testing every 2 weeks for staff, of course a more aggressive schedule if someone shows up positive in the nursing facility, but we're asking that they do that. We're supporting that. Our guidance is up on the Kentucky COVID-19 website. Please go there if you're a nursing facility. And if you're a laboratory, we are giving you the opportunity to contract directly with us. I signed that contract today, so it should be ready and up at least by tomorrow. But the guidance is already up. I invite nursing facilities to go there and look for that guidance, as well as I said, the laboratories to be able to go there and do that as well. We continue to want to support our nursing facilities. We're glad to partner with the federal government. We're making sure that our guidelines dovetail with the guidelines from the federal government so that we can have a consistent program and keep our folks safe. And we do feel it's our responsibility, since we are asking people to test, that we should be able to provide the means to do that. And so that's what we're announcing today. Thank you.
With that additional testing, it's been called different types of, there's been different terms. I think we're calling it maintenance testing. I believe we'll have lived up to the absolute best practices to help protect our long-term care facilities. In both doing the testing of all nursing homes, everybody wants to establish the baseline, and then to do this type of testing. You know, some states have done one, some states have done the other. There's only a select number that I know of that have done both. But I think everybody is moving in that direction. We all realize that this is one of the biggest danger zones for this virus, and that's both on the federal level, where they're pushing out PPE and providing a lot of advice on it. Just to make sure I didn't misspeak earlier, because thankfully we got some great folks watching. Our positivity rate today was 4.94%. I thought that's what, okay, well, yeah, we make sure we get it right. All right, we're going to open it up for questions. We're going a little short today. I think I started over here, the last one, so we'll start with Joe on the far side.
Just a question about universities, dealing with students that may be coming back from some of these areas where they might have to quarantine under the travel advisory. You talked about plans that are being developed, and especially with robust testing being involved in that. Can you go a little bit more in depth about how that's going to look at universities in regards to testing and just the overall plans that are going to be in place?
So the question is about universities, about what steps they are taking or should take as they welcome students back on campus. We talked yesterday a little bit about UK's plan that was put out, and I talked to Dr. Stack a little bit after yesterday's press conference about it. I think it's fair to say that it is still in flux, trying to establish the very best procedures. We want robust testing for our universities. We're also going to face some severe limitations likely in the future on the testing side. With what we're seeing to the south and the number of tests that are flocking there, we're worried we're going to see a scarcity of reagent, and I referred to that incorrectly yesterday. It's not the medium that you put the test into after administering it to send it to the lab. It's what's used in the lab itself for the processing of the kits. I get a breakdown, like at the end of the round the horn, on everything I missed after each of these, and I got a little educated yesterday. Universities, though, and I said this yesterday, they got a lot of brain power, and that's a real positive thing. And I believe that they are looking at, first, what are the steps you take before students get back to help prevent the virus? For folks coming in from states that there's a concern, I would be asking them to limit their outside contacts in the period before they travel. Then it's when they get there, how are you going to help increase the space between people? Looking at your dorms, looking at your bathrooms, looking at those types of things. Then looking at your classrooms, how are you able to spread individuals out? I remember in college that we had some classes where that was easy, they were smaller, and then we had, Econ 101, where there were 100 or 200 students in it in one of those, big rooms. So there's challenges there. And then there's how you proceed once you're there, the testing and how to ensure that you have a safe environment. It's a big challenge, but I do know that there's a lot of thought and a lot of planning going into it. Chris?
Necessarily COVID-19. Today there's news out of University of Kentucky, request by students to take the name Rupp off of Rupp Arena. Do you believe that it should be changed? What's your take on that?
I saw a headline today on some students asking for the name Rupp to come off Rupp Arena. I want to read what they are providing. I want to listen to their rationale before I form an opinion on that. Morgan?
Weddings, and whether it looks like if you're having a wedding at the venue, you can get around a 10-person social gathering, but what about
The question is on weddings. So weddings that occur at a venue or at another group, business, entity that's out there under other guidance is not limited by the 10-person rule. Weddings at your home are a different story because we don't have that way to ensure that we have that same type of sanitizing, that same enforcement of the mask mandate and others. And so we would certainly ask that you, if you're doing it at a home, that you look at really limiting the amount. But what I've seen out there is a lot of people that are sadly having to ask the question, do we want to do it now? If we go around the guidelines and this thing is spread at our wedding, what will that do to how we feel about it and long term what it means to us as a couple or celebrating that day? I don't anticipate that anybody would necessarily be fined out of that, but I would say that if you're just doing it in your backyard or at your farm, I'd be exceptionally careful because COVID could ruin what's supposed to be a really great day. Oh, right. Yes. There is a direct financial interest for business to follow the rules under these requirements and for their own economics. If you have an outbreak of COVID-19 at a wedding venue facility, if your staff comes down with it, you're going to have to cancel your weddings for the next 2 weeks. That same type of incentive or disincentive isn't there with somebody's home. Stu?
Another point that you continually filing, but do you see a date out in the future here, kind of a date certain when you'll be caught up?
The question is, do I see in unemployment a date in the future that we will be caught up? My current goal is to get through initial claims and to be caught up, but this is how, we've talked about a system designed to fail, and we've talked about it in a couple of different ways, the age of the system or the number of people, but the process is designed to push people away too, and that's a process set up by federal and state law. You got to initially apply, you got to get your letter of acceptance, you got to go on and register, and then you got to go on and request your payments, and you have to go on and do it every 2 weeks. Right? That's a lot of steps that are in there, and I believe that it's designed to provide a disincentive there. That in a time of a great economy, maybe that's a discussion to have, that it pushes people back to work, but it makes it really hard now. So I believe that there will be a time that we will be caught up on initial claims. Our hope is problems with a second or a third payment. That's an easier group to deal with, but it may require an extension of the EY contract that we have right now. They are now ahead of schedule. They have already helped with more claims than initially projected, that 50,000. At least the information that I have is that they are over that as of the end of today. But our goal here is to fully get caught up, and we'll have to look at some form of help. Whether that is additional folks from state government or that outside help to stay caught up. Just the numbers, when we looked at filings this week, show you how you could get caught up and then you could get behind almost immediately just with the sheer number of claims coming in.
You called the numbers as it relates to coronavirus in these cases a disturbing trend. What do you believe is behind that trend? And have you given any thought to maybe holding off on preschool or kindergarten while still going ahead with opening middle school, high school?
The question is the trend that we are seeing in children under 5. Has that made me think about maybe holding back school for younger children while moving ahead for others? So a couple of different things in that. We're seeing this trend. I think it's real, but we didn't have a large number of kids under 5 being tested a month ago. And really, you can understand that. 4 months ago, we didn't have anybody being tested. We are still dealing with a virus that the world first learned about in December. We first saw in March. There was no test for until sometime in March. The first set of tests didn't work and had a problem, and we're still learning things about it. There's There's now a study out, and it's just one study, and that's one of the challenges we face in this when we try to make the best decisions we can. It's one study, and it suggests kids over 10 can spread this virus as much as adults. Kids under 10 might not be able to. And so on that, you see some people saying, well, maybe we can open K through 5, and then we worry about the others. Well, I was watching something today where one of the commentators suggested that there may have only been, and this is me listening to somebody talking about a study that I haven't read, saying there might have only been 40 kids under 10 in that study. So it's tough. It's admittedly, we're making the best decisions we can on really limited amount of information on an entirely new virus. So we'd have to balance those two together. Now, where we're seeing it in clusters, other than some daycares, and you got a lot of kids coming together in daycare, so we'd see some. Our hope is that it stays low. We're actually seeing it in high school athletes a lot too. Lawrence.
The UK reported a couple of dozen false positives because of a computer glitch. We're also hearing from people who went to get tested, got tired of waiting, and left without being tested, and later got back positive results. The question is, how can people be sure that the numbers that they're getting are accurate?
The question is on, I think, UK Healthcare reported 26 false positive COVID-19 tests. It dealt with a software flaw from a Thermo Fisher platform that's tested on it. Some other states have had it too. Right now, that is the only report of a lab that we know and can confirm these occurred. From UK, those were 26 out of 30,000 tests. Now, none of us want there to be a false positive, but I do want to put a little perspective on it. Again, we talked about a virus that we just learned about in December, that there wasn't a test until March. And between March and today, we've done 500,000 tests in Kentucky. There's going to be some issues with a brand new virus, with a brand new test. And it means that there are probably some small issues in the data. And we go back and we dedupe, we go back on our death numbers and use the committee. Now, I believe when you look at the overall numbers, they're relatively accurate in the range that we're in. But with something this new, there's going to be 26 out of 30,000 here and there that we're going to have issues with. And that's just being transparent about the data and the challenge that's in front of us. We believe the numbers are generally reliable, that with the total amount of tests that are out there, that the error rate is very low. But remember, there's human error here too. You know, we could also get a report that somebody put in a number wrong at some point. Local health departments and posting on Facebook can do the same thing at different times. But I believe it's generally reliable, and Dr. Stack wants to talk about it too. This is when I get corrected.
No correction, Governor, just an addition. So there was an issue with the some of the testing locations where if you sign up and you don't get a test, you still get an email saying that, I have a version of it, that says it could also mean you created a test voucher but did not actually complete the test. So you have to read the whole email because it may start at the top. Your recent COVID test returned a result of incomplete. This can occur if there is a problem with how the sample was collected with the test itself. It could also mean you created a test voucher but did not actually complete the test. So as is always the case, the details and the facts matter. So I can't say that errors haven't occurred, but I can say that some of those emails, if you just clip the top part of it, could easily convey the wrong message. You could be in that other category where you signed up and you didn't go get the test and you got notified that you could still be infected and should seek testing if you feel that that's appropriate. So the whole... Yes, and I've been pretty consistent for months, I think now. The data has imperfections. It has always had and always will have imperfections. But none of these things that the governor has had to share with you and clarify today have undermined my confidence in the essence of the data, that it is substantively correct, and that our decisions based on it are valid. So all of that I remain comfortable with, yes.
Tom?
You had a slide that you showed over the last few days about the three things from the federal government.
From the White House.
Right, with the masks, closing bars and restaurants. You say next week is a kind of a do or die time for things. What else are you considering having to take action on besides the two things that they have? Yes.
Right. So there was actually one more that the White House suggested here. The question is, what else might we look at next week if we just continue to see escalation as opposed to plateau? And we'll be looking at that. I don't expect, though I would be really happy if we hit early next week and we saw a decrease. If so, man, we know some things that are really working and people jumped on them right away. But I think how many people are wearing a facial covering also has stepped up over the last couple weeks. So there were actually 4 that were put up here, but we already did one other. The federal government also recommended moving down to 10, groups of 10 from 50 in social settings. These will be the first things we look at because these are what the national experts are telling us will have the most significant impact. And if we don't at least see a leveling off, if we go from 600 to 800 next week or 900 and see days like that, then we will have to look at doing these things. And I think I've said we don't want to because there are some things that happen where people suffer when you take these steps. There's a lot of folks that work in our restaurants that would ultimately be laid off again. And there's a lot of restaurants, and these are small businesses, that wouldn't make it if they had to do this twice. Now, what I could say is despite that, if we continue to have an escalation, we can't ignore the advice that's out there from the White House and from the experts. There are steps we would have to take. And we would potentially look at others as well. Our goal would be how do we get the maximum impact on reducing the virus with the smallest impact on our economy in other areas.
Obviously, switched to online learning at the beginning. Fayette County Schools superintendent just about 20 minutes ago recommended that county do the same. Would you be surprised to see, I guess, a domino effect in other counties that begin switching to online learning just right up here? Do you think it's a good idea?
The question is based on Jefferson County starting the year with distance learning. Fayette County, apparently, you're telling me the superintendent recommended that, and I guess that'll go in front of the school board now. Do I see a domino effect happening, and do I think it's a good idea? Those are our 2 largest school districts, and they face some challenges that only they and a couple others do. The level of busing, the number of students in any building. I know I'm a graduate of Henry Clay and in Fayette County Public Schools, so I'm not surprised by that. I would also not be surprised to see one of 2 things happening in a lot of districts. Either a move to start with distance learning or to move the start of the school year back, at least a couple weeks in August to see if we can get control of the numbers where they are right now. The real challenge that our school boards and superintendents have is we've got an escalation, but we've taken some steps. So will we see a stabilization? Will we see a potential decline? And we're all waiting to see that. If we don't see a stabilization at least by early next week, I'm likely to make a recommendation that if you are early August, that you push back a little bit and give us time to see if we can get it under control. I still want my kids to be able to do in-class learning, at least some of the beginning of this school year. If I believe there's a good plan in place, I will send my kids for in-class learning. I do want to see us stop these numbers from increasing. I do want to see a school be able to spread kids out. I do want to make sure that every child that goes, if they can't be 6 feet apart from somebody, wears a facial covering. I think that those are basic non-negotiables, and I think our school systems know that.
Bouncing off Lawrence's question regarding the false positive issue, are we seeing any issues specifically in nursing homes or anything like that in regards to false positives and the effect that it's having on staff members and their ability to handle the coronavirus issues that they're facing?
The question works off the false positive question, and are we seeing that in our nursing homes? I don't think we have seen that in any of Kentucky's nursing homes, but I will say this in that area. One person, staff member, being positive is too many, and even a false positive should be enough for us to say, whoa, let's make sure that we handle this situation because of the devastating effects that it could have. We haven't seen a significant issue there. We're always worried about staffing in these facilities, though. You know, when I will say, when we went in and tested everybody in the nursing homes, especially, there were some that said, well, wait a minute, if we get a whole bunch of positives back from our staff, we might not have anybody there the next day. And that happened in a New Jersey, I believe. I believe it was New Jersey early on in this. And while that is a concern, we got to know if people have it so that we can take the right steps. But that was our task force that we created, put together, having the resources to come in and help. I think that we have, there are areas in this where if I could go back, we might have done some different things. I believe our response in long-term care facilities has been one of the better in the country, and I think our numbers show it, especially given the underlying conditions and level of them that we have here in Kentucky. Chris?
About sending kids back to school and as a parent trying to figure that out, a lot of parents are also teachers, and if you were a public school teacher in Kentucky, would you go back into the classroom knowing what you know today?
The question is, if I were a public school teacher in Kentucky, would I go back into my classroom? I wouldn't ask a teacher to do that today. Today, where we are right now, I would not ask that. Again, I want to see where we are early next week. If we've gone from 600 and something cases to 800 and something cases, or 900 and something cases, it shows you really where this is going, and we'll have recommendations from there. They are, and that's why we're talking about early next week. But that's the thing about the virus. It unfortunately doesn't care about our schedules and the timing for our decision making. And we can make a decision, and then the virus changes, and then we've got to look at changing our decisions. It requires us to be more fluid and flexible than we've ever been before. Businesses have gone through it, and schools are too. I know we all want more certainty in life, and this virus just isn't giving it to us. Morgan? The question is, do we have plans to send the National Guard to Louisville this weekend when there's going to be some demonstrations and militia? And always when you use that term, I don't know always how accurate it is, but I think it's self-described here. No, our only request, I think, for this weekend is some specialty decontamination groups. It's not the National Guard will not be out in Louisville this weekend and hasn't been requested. As to when Daniel Cameron makes the decision, we haven't received any request there. That decision will always be based on the overall safety of the community. And certainly my hope is that any announcement will be handled with care and will be done in context where facts and reasoning and process are released. I think when you have a total void of those, it makes it really hard for people to comprehend and accept. And that's regardless of where they're coming from. But we train people, we raise our kids to want to know why. And when we don't give the full why and the data or the reasons that back up the why, then a whole lot of other things can come and fill in that vacuum. So my hope is that there will be a lot of thought and care put into not just an announcement or a decision, but an explanation. Stu.
And Kentucky Youth Advocates and other groups put out word today about a survey which showed 30% of those questioned parents were having trouble finding childcare and coming out of the closure of all the daycares. So are you concerned about long-term availability of childcare?
The question is, are we worried about long-term availability of child care? Yes. I'm worried about so many different things that this virus has impacted, our overdose rate, and so many other challenges that we face. And it is a mean and vicious virus that has impacts beyond simply the numbers that we read every day. I know the Cabinet has now provided, what's our amount of money? Over $47 million to help prop up that industry, to try to help continue to ensure we have capacity moving forward. And now Secretary Freelander is going to make sure that I've given a fully accurate answer.
Just briefly, we do know that we have reduced capacity in childcare. We have surveyed childcare facilities across the state. As of today, we still have about 20% that haven't reopened, both in the licensed and the certified categories. And we've reduced group size. So there is a greatly reduced capacity across our system. We're going to continue to have discussions about what the best way to proceed with our employers and with other folks about how we can perhaps provide some additional support or some additional services, but those are still very initial discussions.
And all I'd add is, let's remember, if we're in a place where it's unsafe to send 30 kids to sit in a classroom with a teacher, we're in a place that's unsafe to send 30 kids to a daycare to be there with a provider. I mean, unfortunately, the virus works the same in both circumstances, and I mean, it's a heck of a challenge. I'm a big supporter of childcare, but I've had to make some tough decisions, and the implications and the ramifications are not lost on me.
Where are we considering the idea of pool testing, and would that help alleviate the burden on healthcare professionals involved in the testing process?
Dr. Stack, you want to talk about pool testing? And that is not the testing of public pools. That is about a type of testing on COVID-19.
So the question is about pooled testing, P-O-O-L-E-D, pooled testing. And this does not change the patient experience. You still get a swab, you still get a sample taken, you have all the information goes in, it gets sent to a lab. What it does is they can take, say if you're going to test 100 people, they take 10 people and put all your samples together, and they run one test well on that sample of 10 people. And if it's negative, that means all 10 people are negative. If it's positive, then they go back and run individually all 10 individual people. So if you had 2 people positive in a sample of 100 and you did this at the ratio I said, 10 to 1, you'd run 10 tests and say 2 of them came back positive, 2 different wells, you'd run 20 more tests, and then you'd find who's truly positive or not. So you'd test 30 individual specimens, but effectively have tested 100 people. And the way this saves materials is then you have to use fewer chemicals and fewer plastic trays, and that can help. So it doesn't change what the patient sees, but it changes what we use in the lab. And it could help, but it only works when the disease is relatively uncommon. So if you have positivity rates in a community of a few percent, it can be economical or cost effective. If you have positivity rates, the closer they get to 25%, it's not cost effective because you have to run so many groups. So it is not a miracle cure, but if you're going to use it in certain settings, it is certainly scientifically validated, and it could be useful for some situations, but it's not going to change our experience immediately.
Lawrence?
You released some research today based on antibody testing indicating that 4 to 6 times more people than previously thought in Louisville have been exposed to the virus. Your thoughts on that, and if that's true, what does that mean this virus is doing perhaps statewide? And secondly, would that reduce the death rate? If that were the case, more people being tested, but the death rate.
So the question is on a study from U of L that I haven't seen today. And so I'm gonna comment, I guess, on your description of it. And I want to make sure that that they believe that there's 4 to 6. Okay, and if that turns out to be accurate, what it means is that this virus is even more widespread than we know that it is, though we think it's certainly more widespread than the testing that we get, that there are more asymptomatic people than we had ever estimated before, and that those asymptomatic individuals can spread this at a greater rate than I think any study or anyone right now has theorized, or it at least spreads at a very fast rate. Yes, that would knock down the overall likely mortality rate, except for the fact that we may have people that are passing away that it may be COVID related, and we don't know because they're not being tested. You know, do I think that more people have it than we know? Yes. So is the mortality rate potentially lower than 3%? Quite possibly. But does it mean that it spreads at a higher rate than right now we can show you in the numbers? I think that's true too. Tom. Yeah, today we got an order from the Chief Justice. We'd asked in a case that we're in Scott Circuit Court, basically for a new judge. And I think the population can understand why. It was a strange place for a case to be filed. They're normally filed in Franklin Circuit. Instead, it was filed in Scott County. And then after we'd been in a couple of hearings, somebody sent us a picture from the judge's social media where he was standing with one of the plaintiffs. I think it was Ryan Quarles, and it said, "My friend Ryan Quarles." Well, we didn't know they were friends, and we hadn't been told that. Now the judge has since responded that sure, that was posted on social media, but they don't have a close personal relationship. I think anybody who's in court that saw something like that could say, hey, wait a minute, everybody deserves a fair trial, a fair hearing. And the Chief Justice, in looking at all the information, thinks we can get a fair hearing, so we'll move ahead. And given everything that we have seen, our expectation is that the judge will be a professional like we are. We'll be able to move beyond it. Ultimately, this is all going to be decided by the Supreme Court now, which they've already stated. Certainly, our hope is that if we have another hearing, that we follow the rules of evidence, that it is focused on the issues that we are actually arguing about. But at the end of the day, I think the position that we should invalidate all the steps we've taken to fight COVID-19 won't just cost us lives. It'll devastate our school systems by eliminating all of their extra NTI days. So Jefferson County's decision to start remotely, they couldn't do. That it would cut all of their funding because it's based on the number of kids that go in. We'd eliminate workers' compensation for our frontline workers that quarantine. It'd be devastating, just flat devastating. And we're hearing from employer after employer about how strongly they support the facial covering requirement, that they believe that's what's going to keep them in business. They believe the study that $10 billion of our economy is relying on us wearing these. All right, last one. The question is on universities, and if I can make it a little broader, the challenge on the testing side, if you need to do that, if you need to do it for all the new students that come in, that's going to be a real challenge. I don't think each of our universities right now, in what I'm seeing, will be able to test every single student that show up. So then the question is, again, Dr. Stack said it better yesterday, than I think I've ever heard it. You can't test yourself out of the virus. All it tells you is if you have the virus. So a big focus of our universities need to be prevention of the spread of the virus. And so I think the most important thing our universities do is put the policies and procedures in place that spread people out, require social distancing, require the facial covering, don't have a whole lot of people in one dorm room or a high capacity dorm, and that'll be a challenge. The classrooms being the same, and then you've got to have some monitoring program on the testing. That's where I think testing really comes in. And how do you do that? So some models out there are faculty, that if you ask faculty to be tested on a regular basis, you'd get some idea of what the spread is on campus. But again, it's a challenge. It's like when you look at the rest of the state, but smaller. How do you find out how much infection you have? But then how do you prevent it from going further? And I know each university, I mean, their physical layout is so different. Their student populations are different. Their percentage of folks from out of state and in state are different. And there's no question that they face very difficult questions, but they also have a lot of resources, a lot of brain power, and we're going to give them a lot of flexibility too. Their ability to react and respond quickly, it gives them an advantage over some entities. All right, again, high numbers today, but I'm hopeful. I'm hopeful again from what we are seeing out there that we are taking this seriously, and we're going to do what it takes to stop this. Next couple days are going to be really important. The data we see early next week is going to drive a lot of decisions. But remember, we're going to get through this, and we're going to get through this together. Now, we got a pretty fun ending today. So one thing we asked, given that we know how important facial coverings are, is for members of our media and outside of it, whether it's to make PSAs or put out photos that encourage folks to do it. So today, we've got Tom Ackerman of Lex 18 stepping up to have a little bit of fun wearing a facial covering.
Got it?
You okay?
Karen, you can grab one of this chair here and just pull it up front. No one's gonna be sitting at the side of the table.
I'd like to call this meeting to order. It's a regular scheduled meeting of Clark County Board of Officials on today's date, July 23rd at 5 p.m. Please stand for the pledge of allegiance. Sheriff Pope, will you lead us, please?
Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Please remain standing for prayer. Lord, we just thank you and give you glory for this day. Lord, we don't choose the times in which we live, but we know the one who does. God has determined that this is our time in his world and in his story. He has placed us here to accomplish his purposes in and through us. The Spirit has gifted and empowered us to love and serve people, testify to a different way to live. Through his presence, we become a living testimony to Jesus' love, transformation he brings. We are sent into this world to be his hands and feet, to bring healing and peace and hope. This broken world needs us to love, live, and be like Jesus. The confirmation of this is through his word in Isaiah 54, verse 17. No weapon formed against us shall prosper. So in the name of Jesus we pray. Amen. Thank you. Thank you all for being here today. I know we're crowded, but we're going to try to spread people out as much as possible. So we ask you, thank you for conforming to that. And so appreciate that. Also, too, just to point out, please, if you have your phone on you, please make sure that they are silenced so we don't interrupt anybody or interrupt the course of our business here. So, first item we have here, we have the approval of the minutes from the prior meeting. Everyone had a chance to take a look at that.
I'll second.
We have a motion from Commissioner Glover and a second from Commissioner Sellers to approve the minutes of the prior meeting of July 9th. All those in favor signify by saying aye. Opposed, like sign. Motion carried, 3-0. Do we have any amendments to the agenda?
If there are no amendments to the agenda, I make a motion that we approve it as presented.
Second. Have a motion from Commissioner Sellers and a second from Commissioner Glover to approve the agenda as presented. All those in favor signify by saying aye. Opposed, like sign. Motion carried, 3-0. Next up, we have the approval of the claims and payroll. Claims, payroll, and all in order. Make a motion to approve claims and payroll.
Okay.
We have a motion from Commissioner Glover and a second from Commissioner Sellers to approve the claims and payroll as presented by the county auditor. All those in favor signify by saying aye. Aye. All those opposed, like sign. Motion carried. 3-0. We'll then proceed on with our regular administrative agenda. First item up is Dr. Yazel with the syringe service program. Come up front, Doctor.
Thank you for having me today. I think you guys have seen some of the numbers we sent in advance, but just to kind of touch on some of the highlights again, our return rate's obviously a big focus on that. We want to keep needles off the street, not on the street. We have a 69% return rate for 2018, 78% rate for 2019, thus far in 2020, 82%. And that's well above state levels on any of those numbers. And just to be clear, someone who does participate in a syringe service program is 4 times more likely to dispose of them in a safe manner, whether or not they return to us or not. So that's a big deal for us. Just to kind of hit on some of the other highlights, one thing I always say is through our testing there, we do a ton of testing for HIV, hepatitis C, things like that. We say every case we diagnose early there is very likely to prevent one community transmission of that. And that's not actually a conservative estimate. And if you look at it, we're also in 2018, we estimated we saved over $475,000 in medical costs from early diagnosis and things like that. 2019, again, some of the highlights, we trained over 173 people at the syringe service program in Narcan use. We again proved testing there. Actually, we diagnosed a lot of cases of hepatitis C. So we estimate over $2.1 million of medical cost savings from that time. Also 2020, we've trained 46 people so far already this year in Narcan use. Again, our return rate's 82%. So we're doing great that way. We've already saved over $800,000 in medical costs from early testing there as well. We also put numerous people into recovery directly from the program and continue to have those dialogues. We've got lists of all the referrals that we put people through. People in the syringe service program are 4 to 5 times more likely to enter treatment than someone who's on the street. One kind of unfortunate number is during COVID. In April, May, June, our overdose rates went up 150%, 300%, and 100% in those 3 months. May was actually the highest number that we've had since we've been keeping those statistics. And so that makes it even more essential to have these services out there because, we have just a potential, real nightmare on our hands with that scenario right now. And as we're all seeing, it doesn't look like there's a whole lot of end in sight right now. So it makes it even more important. So and I got some graphs. I don't want to, take your time up with a lot of statistics, but basically we respectfully ask for a 2-year extension on the program, and I'll take any questions that you guys have at this time.
We still doing the mobile exchange?
We haven't got out there as much as we'd like to, just for various reasons right now, but we've been kind of focusing on where keeping our program good in-house, and we'd like to continue to expand that. Actually, we have a lot of we've got a new grant that we've kind of had to, unfortunately, with all the COVID stuff, put on the back burner a little bit to expand our services even more. And so I think we'll continue to see better return rates, reach more people, and things like that over the next few months.
With our return rate, where do we rank in the state?
We've got to be. I haven't seen anybody consistently higher. I don't.
Yeah.
Yeah.
I don't know the exact number.
And I think honestly, as one of our projects is to increase our community returns as well. So that's where a lot of the ones that they do have a month that's above us, so we usually do a lot of community returns and things, which we plan to buff up too, because my ultimate goal is to actually have a net, positive instead of negative on that. I'd like to be over 100% return rate.
So you're asking for a 2-year extension, which is, say, like, push it out.
Correct. That would be hard.
Yeah, I know. I don't know. So we just, depending upon whatever, hi, I'm Erica Shelton with the health department. So whenever you guys decide today, you would just forward us a copy of your meeting minutes and then maybe a letter that says what your decision was, and that was, make sure Dr. Docs received it.
And also, we've ensured that anytime you want a progress report or any questions or concerns, I would be happy at any meeting to come and provide an update or anything like that. And again, we pledge to continue to run a program that you're proud of as a county.
Any questions from any board members?
I'll make the motion to extend the syringe service program until 2022.
Motion from Commissioner Sellers and second from Commissioner Glover to approve the extension of the syringe service program to 2022. Any other questions? All right, all those in favor signify by saying aye.
Aye.
Opposed, like sign. Motion carried 3-0. Thank you, Dr. Yates. Appreciate it. Next up on our agenda is the EMS ambulance service. This is basically a discussion about the current situation with ambulance service here in the county. Yes, sir. State your name and.
My name's Chief Brandon Skaggs with the Clarksville Fire Department.
Okay.
My address.
Thank you, sir.
I'd like to thank you all for allowing us to be placed on the agenda to discuss this topic. I prepared a statement initially, so I can just read that verbatim if that's okay.
Yes, sir.
We can open up for discussion. By the way, you see a lot of different uniforms and people.
Yes.
Good evening, honorable commissioners. My name is Brandon Skaggs, and I have the privilege to serve as a Clarksville Fire Chief, a member of the Clark County 911 Operations Board, and a member of the Clark County Fire Chiefs Association. I have over 20 years in the fire and EMS service, and I was even employed at Clark Memorial ER for a length of time. I believe my experience in emergency medical care qualifies me to talk about a serious situation that has developed in Clark County. A development that puts many of our residents, business owners, fire and police officers, and guests in a potentially life-threatening situation with the service that is being provided by our current EMS. Between June 5th and July 21st, there have been 68 EMS calls where no EMS unit was available to respond to our residents at the time of need. We cannot sustain this type or lack of coverage for our community. So why are these response times and appropriate response times important? Here are a few examples. A person who is in cardiac arrest loses 10% of their survivability for every minute that CPR or AED use goes delayed. A person suffering a heart attack has a better chance of recovery or survival if we can get them to a cath lab in a 90-minute time frame. And a stroke patient has a better chance of survival or recovery if we can get them to an appropriate facility within 60 minutes. These are just a few examples of critical type runs that this county has. This doesn't include any traumatic injuries or, heaven forbid, pediatric incidents, which we all know is held to a much higher standard than public health. Clark County Fire Departments are continuing to provide first responder care, and I'm proud to announce that recently we've had successful resuscitation of a cardiac arrest patient in Clarksville due to the response of a first responder. Clark County Fire Departments have also created a partnership with Dr. Yazel to provide a lay rescuer service known as Pulse Point. These programs have proven to be beneficial to our customer base. However, it's not enough. I ask this commission to recognize the seriousness of this issue and expeditiously help find a remedy. I would also like to thank the men and women and Fire Chief Knoll for providing a backup EMS service when it has been possible. sure you all are aware, probably heard complaints through the grapevine of what's going on right now with AMR, and the amount of runs and how busy that we have these multiple incidents. I think probably the men and women in this room can describe to you the seriousness of that. I experienced one yesterday where a man was unconscious, unresponsive in his front yard, and there was a delayed response. Could have been a possible stroke victim. But the thing about somebody with a stroke is there's nothing we can do in the field that can stop that stroke. You can talk to maybe Dr. Gazel or some of the other medical professionals that we have here. We need to get that person to a facility in a certain amount of time to stop that stroke, try to reverse those symptoms and signs so they can make a full recovery. I come before you tonight representing many different agencies. I would love to be involved in any type of committee or review of the bids, along with Dr. Gazel's approval and commission. But we really have to take this seriously, and we have to figure out something very quickly. I'll open it for discussion and questions if you have any.
I just got one. I've got a list here of the summary of no units available. You said that you was a situation where you had a gentleman unresponsive in his front yard. How do you, as a first responder, how are you told that there's no unit available?
On dispatch.
So dispatch tells you there's no unit available, and then that goes to a secondary call out to another EMS service.
Director Michael's here from Clark County Central Alarm. He may have a better detail on that, but I know personally from our Clarksville Fire Department, if we hear no unit available, then we immediately start calling for mutual aid. New Chapel Fire and EMS has been the mutual aid service that has picked up many of those runs. I think Chief Mel told me the other day was in excess of 100 runs so far.
So that's not dispatch. So Brad, you don't tell the people on site that there's no units available and then automatically goes to dispatch New Chapel. I'm just trying to understand how that works.
How it works is in AMR's area,